what the public health emergency has taught us about sustaining telehealth, and also introduce our wonderful speaker for this track, Andrea Shipley. She is a project coordinator at Wyoming Telehealth Network. She has no disclosures to announce. And you can also find her full bio on the attendee website. Please reference your screen for the CME spiel and also the learning objectives for this session.
Our objectives of this session today is to provide national findings on the effectiveness of telehealth provided during the public health emergency, including some return on investment, which we're seeing a lot of data come out about that. We're going to explain what's next in sustainable implementation of telehealth in the future, provide examples of how telehealth implementation during the pandemic shifted the healthcare landscape, and instruct on best practice models for telehealth implementation and sustainability. And then we'll talk a little bit about the programs here at the Wyoming Telehealth Network. So who are we? The Wyoming Telehealth Network supports healthcare entities, providers, and specialists to increase access to care and improve health outcomes for Wyoming residents through professional development, collaboration, and leveraging of telecommunications technology. That means my boots are on the ground with a lot of different providers. We are connected to the Northwest Regional Telehealth Resource Center, which you can see telehealth resource centers are sprinkled across the United States, and they do have some federal motherships, including the Center for Connected Health Policy, which is a great place to keep a pulse on the different policies that are changing. There's a TTAC, which is really about telehealth technology, and the National Consortium of Telehealth Resource Centers. Those are great places to go if you're looking for resources. Y'all have been providing telehealth during COVID, so you know the patient benefits of telehealth. We know that it can mitigate the risks with travel, with the cost of getting to an appointment, taking time off work, actually having people show up for their appointments more regularly. And so we are very excited about the data proving that, patients can receive care sooner, and we can avoid that escalation of illness and overall healthcare costs. The provider's benefit of telehealth is really about, finding ways to make your work more efficient and being able to care for your patients in a timely way that saves your practice money and really results in you being able to hit your goals. So a little bit on return on investment for telehealth. This is from rural Utah. I think this is really striking in that you can see that patients saved on time and travel related expenses a whole almost 5 hours back in their life was the average of how much time that those patients were saving, and the savings at $33,000. That's just huge. But when we look at the local hospital, which we all know that hospitals always were challenged to not have their budgets run in the red before the pandemic. Since the pandemic, it's even harder. This local hospital saved $3.6 million. That's huge. So that's a huge return on investment. Another return on investment case here came from a statewide child psychiatry, a telepsychiatry system, and it resulted in almost a 2-to-1 return on investment, which is huge. Costs avoided, I think, is a really important thing to highlight in that oftentimes we know patients don't go and get the care they need until they're in a crisis situation. So that means trips to the ER and other things that perhaps could have been prevented. Costs avoided using this, almost $2.5 million. Those operating expenses, almost $100,000 for a net savings of $1.6 million. So we really see the costs and the early intervention on some of these situations that could have turned out to be crisis situations. It reduced the number of children taking prescription medications and redirected children from inpatient treatment to community alternatives. And that's huge for families. It's huge for quality of life. And it's everything we want to do as people who care about patients is that quality of life piece. So I want to talk a little bit about the promise of telehealth, right? We are creating a new infrastructure, a new way of thinking about delivering healthcare. If there's any silver lining to the pandemic, it's that, we were able to embrace telehealth in a new way. What we know is telehealth is not the panacea for care. It is a tool in the toolbox. It is not appropriate for every patient, and it's not appropriate for every condition. But it's amazing and is proving efficient and very effective. And oftentimes just the exact same as an in-person visit. So when we think about a framework for eliminating health disparities using telehealth, this is what we're really sort of envisioning, is that history of where we came from and where we're going as a healthcare industry, and creating a culture that includes trust of science and healthcare, which is huge right now. The backlash that we saw during the pandemic is a highlight of what we're kind of up against as far as that community trust and the trust building that needs to be done, and creating that structural anti-racism and understanding that communities that have been marginalized or left out in the past, we really have an opportunity to take a look at all of the data we've collected over the years and really structurally address those excluded populations, building that next layer of inclusiveness and really taking a look at what we can accomplish with equitable telehealth care. And then, of course, there's the structural competence, the ability of providers to appreciate how the symptoms, clinical problems, diseases, and attitudes toward patients, populations, and health systems are influenced by upstream social determinants of health. So it comes as no surprise when people are food insecure and they've been eating prepackaged food from local food pantries and other places and live in a fresh food desert, that perhaps later in life there might be some chronic conditions evolving, including prediabetes and diabetes. So really thinking about those things. Are people really going to seek preventative care if they're sleeping on a bench? So there's big things to be thinking about there. Health literacy is huge. And understanding who do you go for what? What's your first step in getting the healthcare you need? Just the basic health information needed to make appropriate health decisions. Digital literacy is something we talked a ton during the pandemic, and really understanding that folks can't be asked to have a telehealth visit when they don't have access to a device. Maybe they don't have broadband connection. Maybe there's all sorts of other barriers in the way. And so really figuring out how to reduce those barriers. Affordability, the FCC has been trying to tackle this. So they have the Affordable Connectivity Program currently that households can apply for to reduce the cost of internet. And then connectivity is huge, and broadband access in frontier areas. What we're learning in Wyoming is that, yeah, that's being worked towards. There's money, there's funding, but it's just going to take time. So what are we going to do in the meantime to address the barriers that currently exist? So a lot to think about on that front. So I wanted to share this graph because I think it's a nice visual of the shift in the healthcare landscape. So this is looking at EPIC organizations across the United States. And what we see pre-pandemic is that the share of outpatient visits by telehealth were not happening, right? We can see this incredible growth of telehealth visits during the pandemic. And as the pandemic goes on, we see those numbers come down. But what we're noticing nationally is that when we reach about 15 to 20% utilization, that's kind of where folks are right now and where we see telehealth being used for the foreseeable future. So it's a very large modality, and it's clearly needed. Telehealth utilization continues even as the public emergencies are lifted at the state level. We're seeing a utilization rate that rose 1.9% nationally in just recently. And so it is also making up 5.3% of the medical claim lines nationally. So a very important tool in the toolbox. Patient satisfaction with telehealth has been really wonderful to see. It really hinges on the technology and the patient-clinician relationship, right? We know good healthcare always depends on that relationship that you have with the provider and establishing that in a really strong way. And that can be accomplished through telehealth as well. But you can see here more than 80% of patients agreed or strongly agreed that their virtual visit was as good as an in-person visit. That's huge. And understanding that they will be using this sort of visit in the future. On the other side, provider satisfaction with telehealth is a little bit lower. As you can imagine, you all have your boots on the ground in facilities across the United States. And during the pandemic, it was a learning curve for everyone to bring their digital literacy skills to a place where we could serve in our jobs, in our clinics, in our facilities. And it was a tough shift for providers, and there's a variety of reasons why. We know that there's a ton of vendors and platforms out there that were all vying for the business of folks. And some of those telehealth platforms were easier to use than others. Some were well prepared when they were launched, and some were learning on the backs of providers. And so it was a hard road to hoe, but I think as time goes on, this will continue to get easier and easier. But in a recent Mayo Clinic study, more than 75% of respondents said telehealth enabled them to provide quality care for COVID-19 related care, acute care, chronic disease management, hospital emergency department follow-up, care coordination, preventative care, and mental health, behavioral health. That's huge. That's what we want to do. We want to serve our patients. So this is a good question. If telehealth is so great, why are there still barriers to embracing its promise? As I said, getting started can be cumbersome. That's why organizations like the Wyoming Telehealth Network exist. We help with everything from implementation to sustainability and can provide that foundation. Now, I have in this presentation the nuts and bolts of telehealth. I'm just going to go really quickly through this. Most of all, I just wanted you to have access to my slides afterwards. I know a lot of you may be in a more sophisticated place with your telehealth delivery, but maybe there's one piece around evaluation you wanted a new tool for. So I'm just going to go quickly through this, and then we'll talk a little bit more. But the nuts and bolts of telehealth really start with that continuity of care, licensure, and where you are going to serve patients depending on the state. You'll need to know more about that. Of course, a link here to the Wyoming Board of Medicine and more information about interstate compacts. And then the legal considerations that you want to take a look at when you're providing telehealth, including HIPAA security considerations. There are reimbursement guides here. And of course, a new CMS guidance has come out in November. And so things are always shifting. And once the federal government lifts the PHE, there will be perhaps some new considerations with reimbursement guides and state telehealth laws and reimbursement. really getting going on telehealth and then evaluating and sustaining your telehealth is about forming a team, defining goals, and assessing your program. You need to be constantly looking at that. I think there's a really good evaluative tool here in this Critical Access Hospital Guide. So take a look at that if evaluation is something that you need to be doing. So y'all know there's like a million platforms out there. And sometimes this can be one of the biggest barriers for folks just to get started. I always tell people it only takes one patient, one provider, one platform. And here at the Wyoming Telehealth Network, we actually offer free HIPAA secured Zoom licenses for any provider who is providing healthcare in Wyoming, because we know that the expense is a barrier, but then also the ease of use can be a barrier. Designing workflow is always something that comes into question when getting started. And then, you know, as you continue to grow efficiency with your telehealth. There's a sample scheduling. Here's some patient resource video that we created, something that you can send patients before their telehealth visit to help them get ready and educated for that telehealth visit. Here's more on implementing. Here's more on evaluation. And here's a little bit about the Affordable Connectivity Program that I talked a little bit about with the FCC. Some other considerations to get set up. You know, you want to check your readiness for telehealth. This is always good to come back to is your website manner and trying to create that conversation and appointment with a patient that's as close to an in-person visit as possible. Here's a consent to treat form, patient etiquette, patient readiness, you know, making sure that our patients are ready to go with the devices, the connectivity, and the digital literacy they need is an ethical question when we start thinking about, is this patient a good choice for telehealth? We want those folks to get the same out of their visit as they would in person. Our YTN programming here in Wyoming, I already told you about the HIPAA secure Zoom licenses that we have. We also have a Wyoming Telehealth Consortium that was formed in 2009. This is a legislatively mandated consortium. And we really think about the consortium as a place where our special interest group provider barriers that can't be tackled within those special interest groups can be boiled up to. The Telehealth Consortium has stakeholders, policymakers, telehealth champions, providers who can really tackle the large scale issues that we're seeing with telehealth. Our special interest groups is really what I like to think of is that community organizing piece. I get to talk to providers, hear what some of the hitches are with their practice and address them. We get to do a community of practice, networking, breaking down silos statewide in those special interest groups. And they really serve as a way for us to use our collective voice to enact change. It drives what we know in terms of what providers need education on. We provide evidence-based best practice webinars, toolkits, and guides. Our website is full of great resources and kind of A to Z to get started and to sustain telehealth. We also do consulting and technical assistance. So I'm on the ground in hospitals, senior centers, public health nursing offices, trying to implement some of these pieces. And then we host a telehealth provider directory for those who enroll in that directory on our website. We do have some innovations which have been really exciting in the last couple of years. Like I said, we've been utilizing our special interest groups to identify and overcome barriers. Sometimes that means we're hearing interesting presentations from community groups. One of the cool partnerships we've made over the course of the last couple of years has been with the American Heart Association, which actually is beginning to do a lot of focus in their strategic plan around telehealth and supporting that to improve cardiovascular disease. We're seeing this from the Alzheimer's Association as well. And so really getting out there, not only hearing from providers, but hearing from folks who are on the front lines of addressing chronic disease and chronic disease prevention, as well as community health needs and those social determinants of health and how telehealth can play in that. We currently have a SAMHSA grant here in the state of Wyoming, and there's something called Project Aware. And we are implementing school-based telehealth on a larger scale. As early as a couple of years ago, we only had one school-based clinic in Gillette, Wyoming. And since then, we have grown and now have 6 different counties in our 23 county state that are looking at how can we use school-based health. And in tandem with that conversation is at what point is telehealth appropriate? And what we see more than anything, which is not going to be surprising to anybody here, is that the modalities that are the highest used for telehealth are primary care and mental health care. We see a huge boom with mental health care. And Wyoming happens to be the worst state in terms of suicide in the nation, and addressing that mental health crisis in rural America by using telehealth is a really important key to reducing those numbers. I told you a little bit about the Wyoming Telehealth Consortium. One of the ways that we get the Telehealth Consortium engaged is not only through educating through the legislative session and overcoming large policy barriers and other things like that. But every year we have been involved in the American Telemedicine Association's Telehealth Awareness Week. And we do what is called an earned media campaign. An earned media campaign means we're not paying for the media. We don't own the media, like your website and your listservs and things like that. But we are reaching out through letters to the editor, opinion editorials. We're submitting press releases. We did a governor's proclamation proclaiming September 25th through the 18th this year as Telehealth Awareness Week. And then we launched the first ever Telehealth Champion Award this year in Dr. Jim Bush's name. And we were able to award a telehealth champion who's worked for decades in Wyoming to, push the rock up the mountain for telehealth. And so that has been a really successful and really fun way to get involved. And one of the other ways, and this is an idea that came out of our special interest groups from a telehealth champion named Dr. Amanda DiDiego. She was looking at the American Recover funds, the ARPA funds, as they were going through the legislature, and created a program around telehealth in Wyoming public libraries called Public Access Telehealth Spaces, or PATHs. And this is something we will be piloting in the next year, and it will create telehealth booths in some targeted locations in Wyoming in order to provide stigma-free and easily accessed spaces for those who maybe can't receive healthcare at home, need a safe space, don't want their truck to be seen in front of the counseling office in small town America. An opportunity to use these telehealth booths. Our first launch will be in Natrona County, which is where Casper, Wyoming is. And so many of the local homeless folks actually hang out in front of that library because that is directly on the bus line, and talking with the federally qualified health center that treats the homeless in that community. This could be a huge way to do some more care in that community. So we will be collecting data, and we will be creating an implementation model on that project. We're very excited about it, and supporting Dr. DiDiego in our capacity as the Wyoming Telehealth Network. We're also working with folks who are doing this work regionally and nationally. It's an interesting concept that has grown legs across the nation. So there will be provider partnerships to be had with that. So what can you do today with all this information? So I want you to consider if you could use telehealth innovations to expand your practice. What sorts of infrastructure and support do you need to make sure your telehealth practice can be taken to the next level? It may be that you're looking at remote patient monitoring. You may be looking at a new platform. You may be looking at different ways to organize, like Wyoming is with its consortium, with its special interest groups, and how to create that and promote that telehealth is available within your practice. And then you, like I said, identify how to get involved in your state if you feel passionate. There's a lot of work to be done when the federal PHE ends. If your telehealth work is not codified in your state policies, you will be working on federal policies, and we don't know what they'll look like yet. And so there'll be a lot of congressional work that will be done over the course of the next 6 months to a year to really ensure that telehealth is as strong and viable, both in those policy world settings and within our own clinics and facilities. Here's a little bit more telehealth resources. There's our website, our Northwest Regional Telehealth Resource Center, but here are some more of those national resources that I talked about and links to those. And with that, I will open it up to questions. And I appreciate you all being patient with me as I got my presentation going.
Excellent presentation, Andrea. Thank you so much for that. So we do have several questions in the chat, so I'm going to go ahead and get started so we can get to them all. First question is there data available on infrastructure as far as connectivity, availability of access for rural communities and underserved populations?
Yes. I would go to the Rural Information Hub and do a little bit of searching on that because I think it depends from state to state, depending on where you live. Your business alliance in your state will likely have some information on where that connectivity is and where it's headed. And so I would encourage you to look at some of those resources to understand what's happening there, and take a look at the Federal Communications Commission website as well, and see what the FCC is doing in terms of expansion of broadband.
Awesome, thank you. Regarding broadband, do you see broadband networks more willing to partner with entities to provide telehealth for rural areas, or is there still some hesitancy that you're seeing?
That's a really good question, right? Because we know as businesses, folks are always holding the cards close to their belts and figuring out, how do we serve our community and still run as the corporation we want to be? And so, yes, we do see some partnership, but I think the bottom line is this: there's a ton of money and support being poured into making sure that rural communities are connected in 10 years. And we know the work is happening, but what do we do in the meantime? It's like we can't speed up the timeline. We know it's coming. What do we do? And so, great question. I think you should continue to explore that. The lovely thing about rural communities is sometimes we don't always have the Verizons and the T-Mobiles and the larger corporations. Sometimes we have more of the mom and pop flavor. And so there is opportunity to have unique collaborations and to build best practice models of working with our local broadband providers. One of the ways YTN has done that is that we have a Families to Families grant that offers free devices, so tablets for folks who want to use telehealth but don't have those devices. Those devices have been loaded with 2 months of data thanks to Verizon. So thinking about those different kind of ways that we can do that.
Awesome. Do you see any challenges arising for providers being overextended as telehealth creates opportunities to see patients faster?
Such a great question. You know what? Telehealth doesn't mean like you should see all of your appointments and patients during the day, and then you should do telehealth too. No, don't do that. building telehealth into an afternoon or one day a week or however that best fits your practice is what it's about. And hopefully, and what we've heard and seen in data is that it actually makes your practice more efficient in that it really reduces those wait times, but allows for more flexibility, hopefully, in your schedule around those telehealth appointments. I would just really encourage you to be thinking about that workflow, be thinking about your work-life balance. And when you implement, make sure you're implementing from a point where it's not creating an additional work from you. You're working hard, you're providers, and you're burning out, and we need you so badly. So take good care of yourself.
Absolutely. Absolutely. All righty. We kind of touched on this earlier, but there was another question in the chat about it. The question is, do you foresee a universal movement for some access to telehealth and insurance coverage for it because of the lessons we've learned from COVID?
In my opinion, yes. Will that be a reality? Gosh, I hope so. We talk about this in our office all the time, right? It's like, okay, where are the pressure points within telehealth that we can get more access for patients and better work-life balance and better support for our providers? Like, how does this help? How does this help? And that's a question all the time. Like, right now, we're really focused on getting providers up and rolling, understanding what those barriers are, working with policymakers. So it's really this kind of public admin piece. But on the other side are the patients. Are we going to see a grassroots land swell of patients saying, this is how I want my healthcare, and this is what I want from you payers? And is that the pressure point that we need to be pushing as we move further? I don't know the answer to that question, but I do think that doing everything we can to ensure that federally we're going to see some of the same parameters for telehealth care that we saw during COVID is the best bang for our buck. A populist movement with patients would be amazing, but I think it's a tougher hill to climb. So we need to be doing everything we can right now to be talking to folks in that policy realm about, hey, this is what our patients want. Here are the numbers. Here's what we know. And as providers, we need to be paid the same for a telehealth visit as we do an in-person visit. And here are the reasons why. So really making those messages clear, getting involved with, the associations that are part of your community, and working with that collective voice, I think is so important right now.
Okay. All righty. Our next question is, in rural Nevada, the unlocking of telehealth has been a welcome development for my world of child neurology. A working video connection is sometimes a barrier to care, and judiciously jumping to audio allows to provide the care. Do you have any comments on that or experience in that?
Yep, absolutely. It's so frustrating when, your connection becomes unstable, and especially when you're working with neurology and trying to see people and understand physical abilities. So here's my thoughts on that. One, make sure that your facility is set up with the lowest minimum standards required for telehealth. So in that tool guide that I went through real fast, there is information on that. And so that is one thing. Of course, on the patient side, what do you do? And that's the tricky part, right? The other piece that as providers and administrators, we have a little bit of control over is what platforms we're using, right? Some platforms are much better than others. And so really examining that and seeing if that is your barrier. But if your barrier is truly around the patient's broadband, start thinking outside of the box about how the patient can best access you. Do they need to be going to and reserving a room at the public library? Do they need to be going to public health nursing where there is good internet access and they can find a private space to be in? Is there a private space in the local fire department? Where are there public spaces where people can access broadband broadband access that aren't necessarily the car appointment in the McDonald's parking lot? Thinking about creating that space and that environment and that interaction that's going to be close to as in person as possible. And then, being able to educate our patients around, hey, let's try not to have an appointment while you're driving down the road with 3 kids in the back of your car, or, the television on and cooking beef stew at the same time. Like, let's sit down in a quiet place and really try to have that interaction together. So, yeah, I mean, I hear you on those barriers. And again, it's part of that, like, we're getting there, but we're not there yet. So what are we going to do in the meantime? And so thinking about that, thinking about organizations that can help you. Are there local senior centers? Are there programs and grants available to get people the devices they need and the data plans they need? So those are some of the workarounds our providers have used. I'm always open to ideas if you all have some ways that you've found to break down those barriers.
Thank you.
Mm-hmm.
We have one. They may have missed your answer, but did you find that providers were able to serve more patients through telehealth?
I think it depends on the provider, right? And it depends on the specialty, and it depends on the time the appointment's going to take. Yeah, I do think you can create that efficiency. For instance, we have a telestroke program in Wyoming that is really great, and it has reduced the dashboard time of that provider by an incredible amount. So a provider isn't necessarily having to jet set to different communities on different days of the week. In Wyoming, that's huge, right? Because a lot of times the nearest community that you're going to is 3 hours away. So in that way, it creates a lot of efficiencies. It also creates the time between patients and being able to provide that space to see a client. It can streamline that. So it can give you back an extra 15 to 20 minutes in between patients. Or it can create, a workflow that feels more sustainable to you when you know that Tuesday is absolutely hectic, but Wednesday you're doing only telehealth appointments and that you don't have those hectic in-between points. And I know that it can reduce wait times drastically, which as a provider is incredibly satisfying to be able to do what we want to do, which is serve our patients in the most timely manner possible.
Thank you.